Thank you so much. Dr. Cooper Rider, we have three myeloma questions for you. Um, Very heavy myeloma audience today. First question is, I have myeloma and severe neuropathy. What's the best treatment? So I think that might be helpful to kind of talk about how to treat or how to support the neuropathy. Number two, are some people more likely to develop myeloma than others? And number three, can myeloma spread to other areas of the body?
Yeah. So starting with the neuropathy question. Neuropathy is a common side effect of Velcade or bortezomib, which is one of the frontline agents that we're using in myeloma most frequently. So I think when I'm thinking about neuropathy, people that are, we have to, think about patients that are high risk for neuropathy going into treatment. So those patients are patients with other conditions that can cause neuropathy, like diabetes. But also there's a syndrome that overlaps with myeloma, which we didn't talk about today, called amyloidosis. And patients that have amyloidosis, which is where proteins kind of misfold and deposit into tissues, those patients can also be at high risk for neuropathy. So we have to consider those things going into treatment already. And then when patients get treatment, neuropathy is basically, nerve damage that causes numbness and tingling in the fingers and toes. So the best way, and for this your particular situation, the person who asked this probably won't be that helpful. But the best thing is prevention. So I think clear communication with your provider team when you develop neuropathy with myeloma treatment, because doses need to be reduced or spread out. Because prevention, an ounce of prevention is worth a pound of cure in this case with neuropathy. And so we try to adapt our therapies to prevent that. If the neuropathy has already developed, then we typically use Cymbalta, which was originally formulated as an antidepressant or anti-anxiety medication, but also helps with neuropathy. And so we also use other agents that can act on neurotransmitters like gabapentin or Lyrica, which is pregabalin. And so we use those medications to try to help with the neuropathy. Although sometimes in time, right, time off treatment that caused the neuropathy can also help to heal some of that damage. And we do see improvement when we hold therapy. And so I would say those are the things that are typically in my arsenal for treating neuropathy.